Hello, good evening, everybody. Thank you for being here tonight. We have our Facebook Live on nursing prioritization and delegation. I know that all of you were waiting on the on the comment section, everyone. But of course, thank you very much for being here. Before anything else, let me do a shout out to the first few people who came in tonight. The very first people who came in. I think that's Ivy Nicolas. So she was the very first person. I think Asta also, Amusa, Phyllis, Opoko, Laila Tayap, Nel Roma, Rashmi Shrestha, Maria Dabu, Claire Barker, okay, and of course Kailis Johnson. Okay, thank you very much everyone also for those people who shared our Facebook Live for tonight as well. Okay, now you might be wondering, we're starting late tonight a little bit. Okay, but then also, if the Facebook Live is canceled, you will see a post in our Facebook page that it is canceled. But if it's not, then there's no announcement. Then it means to say that the Facebook Live is going to push through. But sometimes, because of technical difficulties, what happens is we do not start on time at 7 p.m. Okay, so that's the reason why. Okay, but if it's canceled, we will let you know. But anyway, for tonight, everybody, before anything else, my name is Mr. Alan Matus. I am a nurse educator. I have been teaching nurses for over 25 years. I have been an NCLEX instructor, and also currently I am a nursing faculty in a nursing program, helping students also pass a nursing program. Okay, and then also I'm the founder of Matus Nursing Review and Matus Nursing Review online NCLEX Academy. And at the same time, I have a book that I published in Amazon, and you can actually purchase the book. Okay, and it's called Simple, Fast, and Easy NCLEX Review Book, and also now it's available in the Philippines. You can email Matus Nursing Review Academy at gmail.com if you want to have a copy in the Philippines, everyone. Okay, so check that book, and of course, for anyone who has my book, if you could give a shout out in the comment section. Okay, so thank you very much, everyone. All right, so I have introduced myself already, guys. Okay, now of course we start our agenda for tonight with our testimonial. Okay, so our testimonial comes from one student. Okay, and she gave this recommendation. I woke up one morning and then saw this recommendation or review in Facebook. She said Matus Nursing Review is the best review, especially on select all that apply. I passed my NCLEX of this review. I have up to 34 SATA questions, but I passed because of this review. Most of the SATA that he taught on Thursdays are on NCLEX. Thank you, Matus, and continue to help students in need. Well, thank you very much for that student who passed the NCLEX, our student, and of course, congratulations. Okay, and you are religiously watching the video every Thursday. Okay, and also we post this in YouTube as well anyway. Okay, all right, so another one. Okay, let's see if we have very nice comments in the comment section. Let me see. So we have, okay, so from Qatar, Leah Aquino Fernandez. Shout out loud here, Qatar. Okay, so I want to visit your place one of these days. Okay, also we have other students. Okay, so we have also wow, there's a lot of people here. So MJ is also here tonight. Also another one, so for tonight, we're going to have our raffle, the free 90-day online access, NCLEX Academy, okay, the access to our academy for 90 days. So we will raffle, pick the winner immediately after the show, okay? So after the show, stay over everyone. We will pick the winner, we'll show the video, okay? And let's see who will win our free 90-day online access NCLEX review. Okay, and another shout out from Raquel Estioko, and she is from Kuwait. So thank you very much. Okay, so we have international students. Okay, yes, and before anything else as well, please, if you have the time or if it's okay, You may share this video with your friends, and also if you're watching this in YouTube, you can click subscribe so that you can always get notifications of our latest videos as well. Okay, so share, and we would appreciate that so that your classmates or your friends will also benefit from this session, everyone. Okay. All right. So let's give a special shout out to other students. Okay. So I'll do a random shout out, everyone. You better put some good comments so that I will see your name and I will shout you out. Okay. So give a shout out. So we have Nimco, Coca-Cola, yes. Rijal Mansa, okay. We also have Raquel Istioco, Revolodom Arnolds is also watching us tonight. Mac Perales as well. Okay. All right. So are you all ready for our first question for tonight? Okay. It's going to be a prioritization question. So we have 4 patients. So you have to choose again the patient that you need to see in this situation. Okay. All right. We keep on doing this because these are the kinds of questions that you encounter in the NCLEX examination. Okay. Prioritization. So let's see. Okay, so I will read the question, everyone. The nurse cares for the following clients in the medical surgical unit. Which client needs to be assessed first? A, the 48-year-old with cholelithiasis who complains of bloating and pain at the top of the right shoulder. B, the 26-year-old post-laparotomy client who reports a feeling that something popped in the wound after turning. C, the 56-year-old client with hepatitis A who excreted dark urine upon waking up in the morning. Or D, the 47-year-old client with duodenal ulcer who experienced sudden epigastric pain 2 hours after eating. Okay, let's proceed. Let's read the question again. The nurse cares for the following clients in the medical surgical unit. Which client needs to be assessed first? A, the 48-year-old client with cholelithiasis who complains of bloating and pain at the top of the right shoulder. B, the 26-year-old post-laparotomy client who reports a feeling that something popped in the wound after turning. C, the 56-year-old client with hepatitis A who excreted dark urine upon waking up in the morning. Or letter D, the 47-year-old client with duodenal ulcer who experienced sudden epigastric pain 2 hours after eating. So which one here is going to be the patient that you're going to assess first? So you have to make sure, analyze the situation and find out which patient has a complication, right? A complication or something that is serious. So question is letter A a serious situation? Okay, is letter B a serious situation? What about letter C? What about letter D? So read the situation properly and choose your answer, everyone. Can also someone, or can you guys put the rationale for your answer? Okay. All right. So this is a very common type of question that you will encounter in the NCLEX, and you also see these kinds of questions in NCLEX reviewers. Okay, so these kinds of questions wherein you have 4 patients, and then you have to figure out which patient will be the one first that you have to address. Okay, so the answer to the question, everyone, is going to be, okay, so let's see if you're all ready, guys. Okay, that would be, let's see if you got the right answer. Yes, correct. That would be letter B, everyone. So the answer is going to be letter B. Number 1 clue for letter B there is the post-laparotomy client. When you say laparotomy, that is a surgical incision of your abdomen, and one of the complications will be, what do you call the complication when the internal organs pop out, or the internal organs are exposed or protrudes, okay, when the incision opens? Everyone, what do you call that? You call that evisceration, okay? So you can either have the splitting of the wound open, you call that dehiscence, and then also you have evisceration. Now, it's very important that if you have evisceration that we need to intervene immediately, because we want to make sure that we don't contaminate the internal organs. We need to position the patient properly, semi-fowlers with the knees flexed, And then we also have to prepare moist, sterile dressing to cover the internal organs, right? Never leave your patient. If somebody is available to help you out, that's better, and that's the best nursing action. And then, of course, report to the physician because a surgery may have to be performed. Okay, so letter B is an emergency there. So very good, everyone. You got the right answer. Is very direct to the point question. Okay, now letter A, I think you're getting the technique because letter A, everyone, is a 48-year-old with cholelithiasis, and it's normal for patients with cholelithiasis to have bloating and pain at the top of the right shoulder. Okay, all right, very good. So letter A is good. But what if I change letter A? You know, somebody with cholelithiasis who has severe nausea and vomiting with decreased level of consciousness, then that would mean probably a complication, right? So, but A means that that patient is okay because that's an expected finding in patients with cholelithiasis. Although you still have to address that, but it's not the first one. Okay, your letter C, the 56-year-old client with hepatitis A, dark urine is expected because of the high level of bilirubin in the blood. A common manifestation in hepatitis would be jaundice, and with jaundice, you have high bilirubin in the blood. Bilirubin has nowhere to go; it goes to your kidney and then excreted in the urine. Okay, so that's why there's discoloration of the urine, which is dark urine, of course. Okay. Um, Letter D, you have duodenal ulcer. We all know that in duodenal ulcer, we have pain that happens 2 to 3 hours after eating. Okay, when the stomach is empty and the pain is relieved by food. So very good, everyone, for knowing your basic content. Okay, excellent. So you have letter B as the answer. So shout out for our students who actively write something in the comment section. Okay. So Rashmi, we also have new people who just came in. My Lucero. Okay, so good start, nurses. Okay, so if that is your first question in the NCLEX, then okay, good job. All right, so let's go to next. All right, so 1 out of 4. Okay, so let's see for the next one. Which of the following clients will be appropriate to assign a new nurse when floated from the pediatric unit to the medical surgical nursing unit or medical surgical unit? A, the 29-year-old client who just came in after undergoing esophagogastroduodenoscopy. B, the 56-year-old client who requires a wound dressing for a stage 2 ulcer on the sacral area. C, the 37-year-old client who is placed on ventilator due to COVID-19 infection. D, the 68-year-old client who needs neuro assessment every 2 hours due to a recent fall. Okay. Which of the following clients will be appropriate to assign to a new nurse? Okay. When floated from the pediatric unit to the medical surgical unit? A, the 29-year-old client who just came in after undergoing esophagogastroduodenoscopy. B, the 56-year-old client who requires a wound dressing for a stage 2 ulcer on the sacral area. C, the 37-year-old client who is placed on ventilator due to COVID-19 infection. Or D, the 68-year-old client who needs neuro assessment every 2 hours due to a recent fall. Okay. All right. So which one do you think? So the keywords that you can see in the question will be a new nurse. Another keyword is floated. Floated. So what we said before was, someone said here, Amber Liu said, so Amber, I'm giving you a shout out. Okay. So let it be the most stable patient. Okay. So Noel Burgos as well, the most stable patient. Very good. Okay. So let's see if you got the right answer, everyone. Okay. Okay. So let's see. The answer is going to be letter B, everybody. So congratulations. So everybody got it right. Wow. I have very smart students tonight. Okay. So letter B, that would be a 56-year-old client who requires a wound dressing for a stage 2 ulcer. Why? Because that is a stable patient. And at the same time, nurses, new or experienced nurses. will know how to change a wound dressing. Am I right? So it is a general skill that most nurses know, and of course, in the pediatric unit, that could be also the same skill or procedure that the nurse is doing in the pediatric unit, right? Changing dressing as well. So basically, number one, a nurse can always do a wound dressing, and number two, it could be something that she's doing in her unit. So you see, you really have, when someone's floating into the unit, you have to really go back and see where is this person coming from, right? So, and wound dressing is a very simple procedure and it's very doable. Okay, so let's try to dissect the other options. Your letter A, who, the key word there is who just came in. Well, came in means unstable, but then you have to look at the, it's not enough. You have to look at the whole, like the whole sentence and the words and the phrases. The fact that this is esophagogastroduodenoscopy, which is an invasive procedure, and most patients will be sedated when they have that procedure. They may have the loss of the gag reflex, they need monitoring, they are dizzy, sedated, and that's why letter A is an unstable patient. Okay, unstable patient, because esophagogastroduodenoscopy is an invasive procedure. Okay, but what about if letter A is just a simple procedure? A patient who just came back after a skin test. Okay, so basically a skin test is not really an invasive procedure, right? Like super invasive compared to your esophagogastroduodenoscopy. So that's why letter A is an unstable patient. The fact that the patient just came in, and at the same time, it's esophagogastroduodenoscopy. Now, your letter C, of course, ventilator settings. You don't want to give that to someone who's a new nurse and at the same time COVID-19 infection. Okay. Now, letter D, neuro assessment. So that is a unstable patient, every 2 hours, recent fall. So basically unstable patient. So very good. So we have Joyce, Jamila said, just came in C, placed in ventilator, D needs assessment. Very good. So these are exactly the kinds of questions that you receive in the NCLEX, everyone. Very straight to the point, very simple, especially at the beginning, and then it becomes more difficult later on. Okay, and the questions in the NCLEX, so most of the time they're really direct to the point, and at the same time, the answers are not meant to trick you. Okay, the answers are not tricky. You just really have to know your content and really analyze the question properly, everyone. Okay. All right, so let's have your delegation question. Are you ready for delegation, everyone? Okay. All right. So Yoshika said, I hope I win because I need it most to review and experience. Okay, so we'll try to find out tonight. Okay. Okay, so let's have your delegation question, guys. All right. So delegation question, the registered nurse gives assignments to the unlicensed assistive personnel or UAP and unlicensed practical nurse or LPN in caring for a client with Clostridium difficile infection. Which task can be delegated to the UAP? Select all that apply. Again, the registered nurse gives assignments to the unlicensed assistive personnel or UAP and licensed practical nurse or LPN in caring for a client with Clostridium difficile infection. Which task can be delegated to the UAP? Select all that apply. A, assess the characteristics of stools. B, assess the client to the bathroom. C, rinse the bedpan. D, apply moisturizing lotion during perineal care. E, check the skin turgor. And F, obtain the temperature every 4 hours. Okay, what's the answer to this question? All right, so we just have a few people just came in. We have Binda Podel is watching. We have Nerissa Rancapero, Ange Marie Louise. We have also Maymay Lucero. Hi Maymay, how are you doing? I'll see you on Saturday. So we have some students here for our Saturday classes. Okay. We have Vivian Sunday is also watching, and Revelo Doms again, and Mulo Hadera. Okay, thank you very much for being here tonight, guys. If you can also put in the comment section, your location from which country or from which state you're coming from, guys? We want to find out if we have new students for tonight. Okay. All right. So Itohan is also here tonight. Hi, Itohan. How are you? I think Itohan was mentioned the last time. Okay. All right. So let's see what will be the best answer to this question. So we have Nerissa is from California. Hi, Nerissa. How are you? Okay, we have from Minnesota, Evodia Chumbon is from Minnesota. Hi, hello, how are you doing? Walnut, California is Maria Princess Canaveral from Walnut, California. Hi. And from Houston, Texas, hopefully you're all okay there. I think we're having a power outage or blackout in Texas. Hopefully you're not affected, you're fine. Okay. From Nepal, we have Asta Gimiri. Thank you. And Boston, Massachusetts, Sandeep Piku also. Okay. All right. So let's see the answers, everyone. So the answers to this question will be, all right, let's see. Okay, congratulations. That would be your B, C, and D, and F. I think most of you got it right, everyone. Okay, so very good. So letter B, that's a responsibility or a task that a UAP can do. It's activities of daily living. Letter C, rinsing the bedpan. Letter D, applying moisturizing lotion. Letter D, I want to make sure of this, guys, okay? Moisturizing lotion is okay. However, if it is a medicated lotion, okay, a lotion that is ordered by the physician to treat a wound or rashes, for example, then it has to be the licensed nurse. So be very careful in the NCLEX, everyone. Moisturizing lotion is okay. Now, letter E, check the skin turgor. That is good. No, letter E is not included. Your skin turgor, checking that would be the RN. Letter F, obtaining the temperature or routine vital signs, that would be okay. Every 4 hours, everyone. So going back to this, A is not the answer because A, assessing the characteristics of stool, that would be for the registered nurse, of course, or the licensed nurse, the RN. Checking the skin turgor, that would be also for the RN, everyone. So that would be your assessment. Okay, that would be the licensed nurse, checking the skin turgor. Okay, all right. So congratulations for that. Direct to the point question. Are you ready for the last questions for tonight, everyone? Okay, I don't want this to end, but okay, hopefully you're learning something, and I think you're all doing well. So I think are we gonna pass the NCLEX now? I think most of you got the correct answer. So good job according to Mai. So she said, yay, good job, nurses. All right. So we have the last question for tonight. Okay. All right. So which task can be delegated by the registered nurse or RN to the licensed practical nurse or LPN when caring for a client who underwent open cholecystectomy? Okay. So we have Noel Burgos is from Kingdom of Saudi Arabia. Okay. So which task can be delegated by the registered nurse to the licensed practical nurse when caring for a client who underwent open cholecystectomy? A. Revise the care plan to prevent respiratory complications. B. Collaborate with the dietitian regarding diet after discharge. C. Teach the client on the importance of deep breathing and coughing exercises. Or D. Assist the client when using the incentive spirometry device. Okay. All right. You're welcome, MJ. Thank you, sir, for clarification about applying the lotion. Yes. So be careful with that. And Leia also said, thank you, sir, for your talent that you're using to share with us. God bless you more. Thank you. Okay. So which one do you think can we delegate to the LPN? Okay. So let's see who gets the right answer for tonight. Direct to the point question, something. And I'm really very happy because students always go back to me, or to this session. They always say, oh, sir, I passed my NCLEX. And most of the questions that you have in your Facebook Live, most of them are in my NCLEX. So basically, you're applying the concept in your NCLEX, right? So it's really very good, guys. Really very good. really very happy that you find this very helpful in your NCLEX exam, and I cannot count anymore the number of students who have been testaments in passing their NCLEX, and they say that they have a lot of questions like this. Okay, all right. So the answer is going to be, before anything else, let's have Yoshika. She says A, B, and C all needs to be done by the RN. That's why D is the answer, and it's under the scope of practice for the LPN, or licensed vocational nurse, or LPN. So very good. So let's see what's the answer for this, everyone. Okay. The answer is letter D. So congratulations, guys. Letter D is the answer. So we have letter D, because assisting the client when using the incentives parametry, that will be the RN. The LPN can do that, assisting only. However, if it says explaining, teaching why incentives parametry is very important, how it works when teaching the client, especially first time to use it, then that would be your registered nurse teaching. So letter A, B, and C are not the answers. Letter D is the answer, because that is within the scope of practice of the LPN. Very good, guys. Okay. Now, revising the care plan. I told you before, development of the care plan, care planning, revising the care plan. That would be the RN. Okay. The team members can only give suggestions, but the RN is the one that consolidates everything, creates the test plan. Okay. Now, letter B, collaborate with the dietitian regarding diet after discharge, then that would be the RN. Anything that has to do with consultation, okay, discussing with other healthcare team members, or coordinating or collaborating, that would be your RN. Okay. Now, letter C, teaching the client on the importance of deep breathing and coughing, then that would be, of course, your RN. Okay. All right. Thank you. So we have a person who asked a question. Hi, Sir Alan. How often do you conduct live review like this? So far, we have been very religious. We have been doing this every Thursday from 7 to 8 p.m. We would like to start at 7, but sometimes, technical issues, so we start late. But then we usually do this every Thursday. Okay. All right. So that's it for tonight, everyone. Okay, if you need more of this information, then of course I have resources for you. So we have the Matus Nursing Review online NCLEX Academy. Everything that I want to share with you, prioritization, delegation, basic content, especially content, is in the NCLEX Academy. And all of the videos that we have here are also in the Academy, everyone. So there's a workbook and there's a book as well, especially the workbook. A lot of students like the workbook, of course. So that is something that a lot of students find really very helpful, especially if you graduated like 10 years ago or 20 years ago. It doesn't really matter, everyone, okay? Because this is a content review for all nurses. Okay, now let's have the winner for last week. So the question, who was the winner last week? We posted a winner. You already know this. So let's just congratulate Rich, John, Hanan, Ricardo. Okay, so he is the one who won last week. Okay, so congratulations to you. So after this session, we're gonna pick who will be the winner for 90-day online NCLEX Academy access. All right, guys, and again, I hope that you all will stay safe, everybody. Okay, stay safe. And if you want NCLEX review, simple, fast, and easy, but of course it's comprehensive, then that will be our online NCLEX Academy. So just feel free to email us and we will respond to you guys. Okay, so thank you. Let's just really have some shout out over here. So MJ said, thank you so much. God bless you always. That was great. Thank you so much. And God bless you. All right. So thank you. So maybe next week we'll have a different questioning. Okay. So Joy said she got 4/4, and that's really good. 4/4. Okay. Very nice. So thank you very much, everyone. Okay. And I will see you next week, everybody. Okay. So thank you and have a good night.